All right, we are going to talk about the knee. So, the knee is a super complex and complicated joint. It is primarily a hinge joint between the femur and the tibia. However, when your knee is flexed, you are going to get a little bit of rotation and lateral gliding, and this is actually where a lot of sports injuries are going to occur. We are going to have a lot of ligaments and tendons involved with the knee joint. However, the joint capsule itself, the membrane that encloses everything, is only going to enclose the sides and the back of the knee joint, because on the front of the knee joint, we are going to find the patellar tendon and the patella itself, the kneecap. Now, the patella tendon is actually a continuation of the quadriceps tendon once it has passed the patella. So the quadriceps tendon is going to connect the quadriceps femoris muscle to the patella. The patella is embedded in the middle of that tendon, and the tendon continues down past it to connect the quadriceps femoris to the tibia. Once it has passed the patella, though, it is referred to as the patella tendon. Now, this particular image is showing us the lateral and medial condyles of the femur and then connecting to the lateral and medial condyles of the tibia. They're going to be or have between them medial and lateral menisci, or our little gliding squishy pads to help absorb shock and prevent bone damage. Are going to have a bunch of ligaments that are going to be shown here. So here we can see the fibular collateral ligament connecting the fibula to the tibia. Here we can see the tibial collateral ligament connecting the femur to the tibia. We can also see some additional ligaments that are helping to anchor the quadriceps muscle to the tibia. And this is partially because the quadriceps is not a single muscle. It's actually a group of muscles, and we refer to them as the quadriceps group. That's something we're going to talk about in our muscles chapter. So the additional quadriceps muscles are also going to have tendons that are going to anchor them to the tibia. Because of all these tendons and all of these ligaments, we are going to have a slew of bursa to aid in easy, smooth gliding over these bony structures. One last note before we move to the next slide: the fibulocollateral and tibial-collateral ligaments help prevent excessive rotation. So our tibia can't completely rotate in 360 degrees away from the femur. If we peel back the patella, we would notice two really important ligaments, the ACL and the PCL. The ACL is the anterior cruciate ligament, and it's going to run from the anterior intercondyle area of the tibia, so the area at the front between the condyles of the tibia, to the medial side of the lateral femoral condyle, so the inner edge of the outer bump of the femur. This is going to help prevent excessive forward sliding of the tibia and hyperextension of the knee. What's hyperextension of the knee? You have probably seen at some point in your life somebody, when they're standing, it looks like their legs are bowing backwards. That is hyperextension of the knee. That's usually indicative of either a very loose ACL ligament or ACL damage. Now the PCL is going to run from the posterior intercondyle area of the tibia to the lateral side of the medial femoral condyle. So the inner portion of the femur, but the outer edge of that. And that is going to work to prevent backward displacement of the tibia and prevent forward sliding of the femur. So both of these ligaments are really trying to make sure the femur and the tibia aren't moving too far forward or too far back from each other. Now, we are still going to have our synovial membrane that's going to line the entire area of that joint capsule. secreting a slew of synovial fluid to allow for smooth gliding and motion. Here are some of those bursa sacs. We have one on the femur underneath the quadriceps muscle to make sure that can smoothly glide over the femur. We have one over the patella or kneecap, which allows for smooth gliding of our skin over the kneecap. We've got another one over the patellar tendon, allowing for the same thing. We have another one over here, and these are just a few of them, by the way. We have another one over here, allowing for smooth gliding of that tendon over the tibia. We've got one off to the side, again, allowing for smooth gliding, and one behind as well. And this is just some of them. There are a lot more. But that is our short little discussion on the kneecap. Next, audio is going to be on joint diseases. Again, it's just going to be a brief overview of a few, and that's actually going to wrap up Unit 5.